Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callendar.
You know, when you look at all these people wearing masks, and you look at the sports events, some of them wear masks, some of them wear them below their noses, and they have all kinds of coverings that they call masks. And this is an example of, they looked at testing 11 different kinds of faith coverings. And they found that the best one were cloth masks. And the ones that had layers, had 3 layers. We know that one of the best is the N95, but they're not very available, so we want the healthcare providers to use those. But anyway, this is the test they use to evaluate the effectiveness or efficiency of the masks, and they found the cloth masks were the ones that were associated with at least a 90% efficacy. That doesn't mean that the other masks don't help. It's just that they're not as efficient as the cloth masks and the layered masks. And in the when you look at the sports events, you're liable to see anything masquerading as a mask. It's interesting that they're considering a national mask mandate, but it's unlikely that it'll happen because we think it violates our constitutional rights.
Oh.
The right to wear masks is like the right to carry guns.
Well, the right to die.
Yeah. That's the N95.
Wow.
At your institution, do you guys wear those, Veronica? N95s?
Only when the patient is under contact precautions.
What about, do you wear shields too, or not?
No.
No, because I know they cited us for not having masks and shields.
Oh, wow.
For areas that you suspect coronavirus, that they should have masks as well as shields. So that's what Joint Commission cited us.
Is it just for those patients, or I mean,
yes,
in like the area?
Yeah, in hot areas, so to speak. Yeah.
Okay.
Yeah, just in those areas where it's high risk for coronavirus, ICUs and those kind of places. Yeah.
Dr. Callendar, is pink eye, can it be related to COVID-19?
Not so far as we know.
Okay.
Right. Although you can get COVID-19 through the eyes, but not pink eyes is separate. And there's no evidence that I know of that is associated that with pink eye. Right.
Dr. Callendar, I have a question. When people were traveling for the Thanksgiving holidays in the plane, they showed 2-3 people, they wore full hazmat thing and were traveling. So do you recommend that they travel in the airplane wearing that full hazmat, everything, you know?
Well, there's an article that I think it may be included that talks about the safety of flying now, because they've changed things around so that the ventilation is effective, and so that right now traveling by plane is relatively safe. It's among the safest things you can do. That's changed from how it used to be.
Oh, okay.
Yeah, actually the most dangerous part is in the airport, not on the plane.
Oh.
Yeah, not the flying, but all that traffic in the airport. Right?
Oh, wow.
This is an interesting article that indicates that Carson is interesting. Let's just say it this way. He's interesting because this instead of him trying he's a physician now, and he's trying these other products that somebody tells him about. And as it turns out, you see a next article that showed that he did not do well with his product. And so he had to go to the hospital, and he now alleges that the medication, and it comes out that all the things you wondered about. I remember Janice talking about, she wondered about what kind of treatment he got at Walter Reed. And he admits here that he was very sick and he might have died were it not for the treatment that he got, that the president got, which they didn't admit until, nobody's admitted until this article says that he got this antibody therapy because I think Janice had suggested that the president got treated better than anybody else in the country.
Yeah, good day.
Turns out that she's right.
Oh, yeah.
Of course, yeah.
Yeah, and so he got this therapeutic treatment that he said that he hoped we can stop playing politics with medicine, but I mean, there's no evidence that he's going to do it. But anyway, we'll see. Trump got his treatment; he hasn't changed. So,
in fact, he's worse because he thinks he can't get it, so nobody else around him needs to be careful.
Right? Yeah.
He's safe.
Yeah.
They're still having holiday parties in the White House.
Oh, yeah. Yeah.
Sad. Yeah. Anyway, here's another article that talks about shortening the quarantine from a week to 7 to 10 days. And it says if you're positive, 10 days later, if you're okay, it's all right.
I think they're using this with the sports teams, with the NFL and the college teams, football teams.
That's right, they are. And they also are using the NBA, they're using the oral test rather than the nasal test. Because remember, as we talked about, they developed, the NFL sponsored Yale to develop an oral test that is simpler and still is as accurate. So yeah, so they do it. I was talking to somebody who's with the NBA, and they talked about the fact that they use the oral test. But that's the test they sponsored. So, and it's very accurate. So. Now this is interesting about an update in terms of the coronavirus vaccine news.
Oh, yeah.
We've heard about 3 products now.
Yeah.
The Pfizer, the Moderna, and then the AstraZeneca. And it looks as though maybe this month, later on this month, some people will be have the opportunity to get the virus.
Yeah, they actually, on NOLA.com last night, our local newspaper said that like Pfizer's already shipped or is already shipping the vaccines to locations around the country for storage for the rollout. So here in Louisiana, they're planning to arrive, I think it said like December 17th. Or something like around that time. And then our hospital emailed us last week saying that, we'll all be vaccinated in December. So I think they've already done a lot of kind of the background work in planning this rollout and getting them to the hospitals and healthcare workers pretty much immediately, which looks like it's going to happen in like the next 2 or 3 weeks.
How many on this call will take the vaccine if given the opportunity to?
I will.
No question.
I will.
Anybody who, anybody who won't?
I'm on the fence. I'm thinking about it. I'm not saying I will.
I'm thinking about it too.
I will take
because
it, but
of my medical condition.
I will take it, but it will not. I don't think it'll be right away.
Oh, I'm gonna take
That's
it.
what I mean.
Yeah, I will take it, but not right away.
Yes, not right away.
I'll take it as soon as they'll give it to me. I'll take
Me too.
I want it. My husband wants
Me
it.
too,
You'll be
man.
first in line, please.
I
Give
would
it
be
to us.
too. Now, here's the problem. Who do they give it to first, Veronica? Who are they going to give it to first in New Orleans?
Healthcare.
The wealthy
the
people.
healthcare workers. So, you know, the physicians, the nurses, the techs,
Take
and
care.
then, so like, I don't, you know, the patients probably, you know, I don't think they're going to get it right away. But from what I've read, nursing home residents too will also get it pretty much immediately. But yeah, no, I mean, just all the hospital staff that's in direct contact with patients.
Do you have many physicians who are on the fence about taking it?
Yes, actually. A lot of my co-residents have been talking about that lately, just because it is, you know, new technology that hasn't, you know, been used on humans before. So people are kind of apprehensive about like the side effects or things that we know that vaccines can sometimes cause, like Guillain-Barré syndrome or things like that. In addition to, you know, any potential like, you know, viral reactivations or, you know, hyperimmune responses, or, I mean, really, who knows? And so I think people are just kind of scared of the unknown, even within the medical community.
Yeah, we have an article on that too, so we'll talk more about that. But
another thing, Dr. Callendar, about this is you're taking a risk either way, because if you don't have any signs of the corona or anything like that, then the chances are you could live a very long life that way.
You mean if you don't get the infection?
Right. If you don't, you know, the chances of getting the infection are higher in some places and lower in other places.
Well, they're pretty high here.
Yeah.
They're pretty high here.
That's right.
But we'll talk more about that because that article is coming up. This is what's very frightening, the fact that you die from the virus.
Yeah.
And we have already 257,000 people died from the virus, which is why I wouldn't hesitate to take it.
Yesterday, 320 people died in Maryland. I mean, in
it was almost 3,000 in the country. It was like 2,800 people died yesterday.
Oh my God.
Yeah. So so anyway, it's a matter of you deciding what you think is more risky for you. You see so many people dying from this disease that, and especially in our age group. And another age group that is interestingly high risk, is relatively high risk, is the age between 40 and 50 for some reason.
Oh my goodness.
Yeah, but yeah. So anyway, these deaths you have to take seriously because it could be you.
Yeah.
In the United Kingdom, where they've approved the Pfizer drug, the first distribution goes to healthcare workers, and after that, age 75 and over.
75 and over. Okay. All right. Okay. Let's go to the next one. We're going to talk more about this later. Chris Fauci is not going to be liked around in a lot of places because he's telling what he believes is the scientific truth, which is not pleasant. And that is, you think Thanksgiving is a problem? How about Christmas and New Year's Eve?
Christmas,
yeah, because that's the time. And of course, poor John Buchanan doesn't look like he could be playing.
No, not Christmas, not New Year's. Yeah, I'm first in line to get the vaccine though. I call my doctor in November. Oh, yeah. She said as soon as it gets there, I'll be getting a call. I'm taking it.
I agree.
Regardless. And you know, people are I guess logically scared about taking a virus like this because they think they'll get just like people think they'll get the flu from taking the flu vaccine, and you can't get it. You can't get the flu from a flu vaccine. You can't get coronavirus from the coronavirus vaccine. But I mean, the other complications with the new technology, with the RNA, they say that this vaccine changes your DNA, which actually I think it does. But you know, it activates the human immune system, which is unbelievably complex. But I'm taking it, period.
Yeah, I agree, 100%.
Dr.
Well, what is it?
Callendar, is this a live virus or
No.
can transplant? No. Okay.
What is interesting is that in spite of all of this concern, more than 2 million airline travelers passed through that, and so that people weren't bothered by the fact that coronavirus is here, and it didn't stop their traveling.
Yeah.
And it's likely not to stop the traveling for Christmas and New Year's either.
Well, not only that, but the vaccine news is causing people to relax. They think they can not take safeguards because there's a vaccine right around the corner.
Right.
It's not really around the corner.
Yeah.
So people are traveling and partying. They're having Thanksgiving dinners, and there'll be Christmas dinners with people not in their immediate household. So I would encourage you, and a lot of these hard-headed people are in the 40 to 50 age group. And so, you know, some of you out there have kids in the 40 to 50 age group that you got to have serious conversations and tell them to stop the foolishness and don't party with people outside your household.
Right.
Daryl, let me correct you a little bit.
Okay.
Once they're grown, and I think most of the parents on here, once they're grown, we have no control over them again. We could tell them all we want to, but I don't know how many of us really have control of our adult children. I don't even want to try because I don't like failure, and I want to maintain a communication level with them until I pass away. So I don't want to stop communication. But maybe somebody on this call has control over their adult children.
Absolutely not. Absolutely not. In fact, there's a rebellion against authority. You know, my kids, if I tell them what to do, the first reaction is, heck no, I'm not doing it because you told me.
Hello.
Yes.
My thing is always tell. You have to tell. And generally, with mine, he'll think about it. And sometimes we'll do it, but definitely put it out. Let him know what your thought pattern is.
Yeah, you should. You're right.
If you tell them, then you can always say, I told you so.
Well, that's actually what Fauci is saying right now, because if in 2 weeks, if we see the biggest surge we've ever seen in the history of this virus, then we'll know that what he's talking about is exactly correct. And
will that change anybody's behavior?
It better, because I mean,
it should.
I mean, everybody will have it then. I mean, you won't be able to go to the grocery store.
Yeah. Sometimes show me will work very well with some people. And once they see these numbers climbing, they may think twice.
Well, I mean, the numbers are already higher than they've ever been right now, even before the holiday happened.
Yeah.
So with this travel and the families getting together without masks, and you know, all the gatherings, and people starting to eat at the restaurants, and people wanting to open up and go back to school and everything, it's going to explode. I mean, you know, I hate to be the bearer of bad omens, but I think it's going to explode even much more bad than it's ever been.
Well, you're at least you're not alone. Fauci agrees with you. Yeah. So think about that as you plan for Christmas and New Year's Eve. Now, of course, New Orleans is a place where they have all kinds of that stuff going on, parties and everything.
Well, our mayor actually has kept things pretty strict here in the city of New Orleans. The governor allowed her to basically have separate control over New Orleans. So while the rest of the state, and that's where actually we're seeing a lot of our cases, they're actually not here in New Orleans. It's in all of the outside, well, they call them, instead of counties, they're parishes here. It's in the outside parishes. And so, you know, she's actually done a really good job. Everything was pretty much closed here until maybe 2 weeks ago. She just gave the green light for bars to open back up, but only at like 25% capacity. And then, you know, like last week, basically a week later, rolled that back. So the city's closed down.
Now this is the topic.
Hello.
90% effective. It's interesting that when Pfizer first came out, it said it was 90%.
This is who?
When Pfizer came out initially, it said it was 90%. Next time, Moderna came out and said it was 95. Then Pfizer said, oh no, well actually it is 95. And so it's interesting that they both now are alleging that they're at the 95% level, which is a great level to be, since the vaccine, as we mentioned before, is only about 55% effective. So it's, and as you had mentioned, it's a different kind of vaccine because it depends upon RNA, and whether that's going to make a difference or not in the long run. And that's why some people are unsure about when they're going to take it, because they don't really know what the RNA effect is going to be long term. As I told you, speaking to my niece who took the vaccine, the Moderna vaccine, she had symptoms for 2 days, just like as though she had the virus, with fever and chills and aching. But after 2 days, it was gone, and that was it. And the question about how long it will last, and some of the most recent studies have suggested that it will be for months, if not years, which is very different from our vaccine, which you need a vaccine every year because the mutations are so fast.
How would they determine how long the vaccine effects last, Doc?
All of the patients who got the vaccine for the next 3 or 4 years will have antibody tests to determine how long it's going to last, because they don't know.
Okay.
Now the other thing is the third vaccine, AstraZeneca's vaccine, may be the most easy to obtain because it doesn't have to be at such low refrigerated temperatures, because the Pfizer and the Modernas have to be at from 20 to 90 degrees below zero. So you need special refrigerators for that.
In the news today, there was a report of hacking.
Hi, Dr. Davis.
Do we have
Go ahead, Darryl.
There's a report of hacking by Russian and Chinese actors against a cold chain for the Pfizer drug that has to be at minus 95 Fahrenheit for storage. And so they don't know at this point if it's research or to just disrupt the cold chain. So
I tell you, you know, human nature is horribly frightening that we would do that. But
what do you mean, Darryl, about cold chain? What does that mean?
Okay, well, they got the initial storage facilities, and then from that, they have to transfer to refrigeration units for distribution that can be at actually higher temperatures, but then they have to be actually disposed of or distributed within a week, I think, at a lower temperature. But you know, these drugs are tremendous for everybody along the chain. You know, they're gold. And my concern is that, you know, what happens if you have something along the cold chain and there's a temperature disruption. And so now the drug isn't effective because it's spoiled, basically. You know, Are those drugs going to be discarded or distributed?
Oh, my goodness.
That's the question.
Mm.
And this is emergency approval has been applied for, but it hasn't been received yet, has it?
I think in Europe though.
Oh, in Europe,
approved.
yes.
England,
Yeah,
yeah.
England, yeah, but not in the United States yet.
Yeah, the date for FDA review is December 15th.
Oh, okay. Mm-hmm. Mm-hmm. Yeah. It's interesting that I guess globally we've had 1 million deaths from COVID, I believe. Yeah. It's a whole lot. Of course, compared to 1918, it's low, but it's pretty high anyway. Who should get to go next? This is the question. The people over 75, I think nobody's going to debate. No, they debate the doctors and nurses, the healthcare providers. But after that, who's to say, huh? Who's to say? And especially since there's the data, as Dow mentioned, that people from 40 to 50 have a surprisingly high death rate. So the rollout is the question, and other issues, as Darrell has mentioned, become of a concern. To monitor it and be sure that along the way, nothing has happened to compromise the effectiveness of the drug. Any other thoughts on how it should be done?
I'm not sure who said this, Operation Warp or something like that. They said that everybody who wants a vaccine will get it in the United States by end of June 30. Everybody should have it by then.
That's correct. Right, but that's a long time.
I know, it is too long.
Yeah, yeah. Especially if you're somebody who's, let's say, 35.
Yeah.
Yeah. But anyway, this is another article about how long should you stay home after you're positive. And of course, we know that the CDC just came out saying that 7 to 10 days is enough. So we'll see.
Nobody wants to step out and say how Black people are going to figure in on these statistics.
Well, we already know that the surveys suggest that less than 50% of Hispanics are going to take the vaccine, and only 66% of Blacks want the vaccine. Oh. So the question is, how many of them are willing to take the vaccine? Yeah. And the distrust issue is so important that we need to have special efforts to educate the Black community who needs it, and the Latino, Hispanic, and the Native American community, because they need it more than anybody else.
Dr. Callendar, when we get that shot, are they going to give us, like, they always give you with flu and all that, what you should look out for, adverse effects and all that?
Yes, of course, yes. That's an important part of all of it, to tell you about the side effects. Yeah. And then after that, you make up your own decision whether you want to take it or not.
I'm glad you mentioned about Native Americans, because last week I saw where this Native American female is talking about Thanksgiving is like a day of mourning for Native Americans because of the violence that happened to Native Americans. And even Abraham Lincoln was responsible for one of the biggest mass murders of Native Americans in the history of the world. Yeah.
Oh my goodness.
Yeah, well, it's amazing how we, I listened to a Native American talking about some of these holidays that they have for Christopher Columbus and all those other people.
Right.
And they talk very differently about them because they consider them, as you mentioned, mass murderers.
Yeah.
which they actually were. And what they've done to the Native American population,
Yeah.
to call it scandalous is an understatement.
Yes.
But so the Native Americans and the Latino Hispanics. And then, of course, the most recent data is showing that the Latino Hispanics, especially in the younger age group, 4 times or 5 times as much as the whites and 2 to 3 times as much as African Americans. So that they are at risk even more so than we are. And this is, I put this one, I thought was good because you need to, remember your history, because there's nothing new under the sun. And what happened in 1918 is happening in 2020, 21. And they talk about the Spanish flu, which we still see today, as being the second worst. The first one is the Black Death of the 13th century. It killed so many Europeans. And the COVID-19 is a close third, although I don't know why they say close, because it's not even over yet, but it'll be third. I don't know about how close. And then it talks about what they did was the same thing we talk about doing today, except that maybe they did it, maybe they didn't. And then they talked about herd immunity. Was never thought of as a measure, because that really doesn't make much sense. So why Trump would favor herd immunity boggles the imagination, except for the fact that he's already had COVID-19. But because that means you would accept 1 million deaths in America before you would have that. So so that's not an option. Yeah. And it talks about social distancing. Of course, they didn't have vaccines then.
That's right.
And so that's the other thing to keep in mind, is that while we have the vaccine, we may or may not have the second drug. For the flu, we have Tamiflu. So if you get the virus and if the flu virus, and you get it, they have Tamiflu. So if the vaccine fails, Tamiflu will take over. So we need to have that second drug like Tamiflu for COVID to really get us where we need to be. And some would say that the antibody treatments that they're giving are that second course of treatment. Any other questions about the pandemics? Because I think it's important to remember our history and do things differently this time. Although, when you look at some of the countries who do things differently, and you think more about Darrell's point about autocracy being better for crises than democracy. But anyway, it's food for thought.
Just wondering what's going on the East Coast. Last week, Supreme Court ruled that governments couldn't shut down churches for the pandemic. So in the Chicago area, a lot of churches, black churches that were closed down, have now reopened. What's going on the East Coast?
Well, in DC, it's different. DC is different because the mayor just closed down the number of people who could go to church. It was at what? It was at 100 at one point. Now it's down to what? 25?
25. In PG County, I got a call from one of my fellow musicians who said that their church got permission to have 125 people last month. But I think that's changed now.
Yeah, PG is going down too. Yeah.
I think Montgomery County, 1-year-old child died of coronavirus, and Larry Hogan, governor, was crying. That was the youngest victim.
But I think the churches around this area is still taking precaution. most of them are still taking precaution and not opening up, period. Even with the people, there's still some congregations, one or two that never closed. But majority, I think, are staying closed, or and most of them, a lot of them that can, they're streaming on Facebook or etc.
Yeah, and it's interesting that many of the big churches are meeting their financial goals, and so it's not unattractive for them to continue as they are effective at reaching their financial goals. Not that that matters a lot, because I hope, because that should not be the motive, but being humans, I suspect it is. And when they file for emergency use, what does that mean? That means if you have an emergency, you can get it, but that doesn't mean that it's okay for everybody else. So, and that's what the December 15th date means. Now, after that, if it's approved, then everybody could get it. That is going to get it anyway. Now, of course, you can declare it as an emergency, though. Once it's approved for emergency use, you can always declare it an emergency.
They have some formula now where you can base the number of people that you allow to come inside the doors of the church by a percentage of your membership.
That really shouldn't have anything to do with it. It
shouldn't.
It should have more to do with the space inside.
Right. Should have nothing to do with your, yeah. But men make up rules to keep men happy, women happy. So
the church that I was talking about is one of those, like almost like a mega church where you can get 800 to 1,000 people inside. So 125 in a space that can handle 800 is, kind of reasonable. But they've even shut that back.
Exactly.
That was in PG. It was actually MPG.
And this talks about the point that Dow was mentioning about the temperatures. And the difference is the AstraZeneca compound doesn't need such low temperatures.
Right.
And that's what makes it attractive for people who can't get to places that have, minus 94 degrees Fahrenheit or even 35 degrees. Minus 35 is.
Let's see. I think I can skip forward to the AstraZeneca article since you're talking about that.
Yeah, the AstraZeneca article is interesting because it talks about how the vaccine appeared to be 60% effective in one group, and then they looked at another group and it was higher, and then they by accident found out they were using a smaller dose, and they found out the most effective group was the group that received the smaller dose. And then when they evaluated those who got the smaller dose, they found that in that group, it appeared to be 90% effective. And the question is, when they go to FDA, which dosage are they going to talk about? And it turns out that they didn't mean to give a half a dose, but it turned out that worked better than the whole dose for the first dose. And then the second dose was back to the regular dose. The problem is that they don't have the numbers that Moderna and Pfizer have. And so taking this drug may not be as safe as taking the other one because they have more numbers. That's where the numbers come into it.
Back to this next one.
So they may They still have some issues with the Astra, John. I thought this was an interesting article that Trump is trying to blame Pfizer on his losing the election. He wants to blame everybody but himself.
Yes.
Yeah, yeah. And I like this part. It said, in his mind, because he said he won the election. Now he's 6 million votes behind, but he won the election.
Did you see last night he actually had a chart made up where he was trying to prove that he won? That was last night on the news.
That's pitiful.
Yeah.
Maybe the COVID affected his brain.
Who knows?
Yeah.
And he had a Christmas party at the White House.
Yeah.
Actually, the worst thing about that is that there are people who believe everything he says.
Yeah.
Yeah.
You know,
That's sad. That's really
problem.
sad. Yeah.
that's the scary.
It's
It's more than
almost as if
sad. It's frightening.
Very.
It's almost like Trump is a counter spy. I mean, he's working against democracy rather than for democracy. But anyway.
But it's also weird because with what's the name of the effort that Trump put in to get the virus tested quickly?
Operation Warp Speed.
Warp Speed. You know, that was his plan. He wanted to, rush everything. I mean, and paid all these companies, big millions and millions and millions of dollars to get the research done, billions of dollars. It's weird now that they follow his directions and, to get the results out as quickly as possible, and then he's going to turn on them as soon as he's losing, pointing the finger at whoever he can,
Except looking at that thumb that's pointing right back at him.
There it is.
Yeah. Yeah, well, anyway.
Yuck.
Well, the one thing about Trump is that there are many good things he did, but he did so many other things that many people will forget them in the long run.
Yeah. Mm-hmm.
They'll remember the way he the classless way he left the office, which is a little short of disgraceful.
I think we talked about this one already.
Yeah.
Okay. And that one. Okay. What about this one?
Well, this is what we're waiting on now because now somebody, there's another article that talks about it's amazing that in this series, nobody, because there are people who would have said that somebody would get the virus from the disease, and of course nobody. Of the 40,000 people that have been involved, nobody's gotten the virus. So that it is an argument against anybody who would have thought that you could get the virus from the vaccine. And that's the difference with this vaccine, that it have 40,000 people involved in less than a year is amazing. See, more than 1 billion just for the
That's just one. That's just one company.
Yeah.
Golly.
30,000 people. It's interesting. They say not one became seriously ill, although what they mean by seriously, when you get fever, chills, you can take it at home, but some people think that's seriously ill.
So, Doc, when they do the tests of the vaccine, how do how do they know? I mean, they have a sample of the virus and give it to some people.
Now, what is your question? How do they know who has the virus and who has the vaccine and who doesn't?
No. I'm saying, how do they know that the vaccine works against the virus? Do they have to give the virus to some people?
No. They just give the vaccine.
Oh, so they're just testing to see if the vaccine is safe, not if it works. But how do they know if it works?
Well, see, first phase 1 is to see if it's safe. Phase 2 is to identify the dose. Phase 3 is to test its efficacy, and that's why Moderna did it 30,000 people to see how effective it is. That's the phase where you look for the number of antibodies produced. And that's
okay. You don't actually give them the virus to see if it works against being exposed to the virus. You only look for the antibodies.
That's it.
Oh, okay. I got it now. Okay, thanks.
Anyway, any other questions? Because I think it's good to have a discussion about this, because I think more discussions like this are critical for the minority populations, Native Americans, the Latino, Hispanics, and African Americans, because they are not going to be trustful. as you can see in our group, we still don't trust it, and they recognize that it's such a short period of time. Most other viruses took 5 to 7 years to develop, but if we did that, then you'd be talking about 5 million to 10 million lives that are lost. So, what about this? If you get an anonymous test saying you've been exposed to COVID, would you trust it? Unlike, for example, in North Korea, where they put your name in a newspaper.
Oh, wow.
So everybody knows.
Wow.
And nobody, contact tracing is the only way you know.
Wow.
And, but if somebody anonymously wrote you and told you that, what would you do? Just get a COVID test, find out.
Dr. Callendar, there must be some restrictions on the rights of those that are in prison.
Yeah.
You can't force them to be testers.
No, you can't force them to be tested or to take the vaccine. And they cannot be used for any kind of experimentation.
Without their permission, I guess.
No, they can't be used unless it's, if you want to survey them or something like that, but you can't use them for any tests because there's concern about their rights, their right to say no. And so it has to be carefully evaluated before they have anybody doing it, because of the violations that have occurred in our populations and Latino, Hispanics, and the disabled people.
Now, now they say the healthcare workers are the first ones. Now, quite a few of them may refuse it. Nurses, doctors, they may not want it. So do they have to take it, or?
No, nobody has to take anything. It's a free country, so we recommend that you take it. Now, the job may say to you, we'd prefer you to take it, but we can't make you take it. Can't say if you don't take it, we'll fire you. That's illegal. So you can recommend that people take it, but you can't make them take it.
So this technology here with the contact tracing from Not Jolly, the first thing that pops into my mind is telemarketers who keep calling my phone. Once they get my number, it's like it's on a database somewhere. I get telemarketing calls on my cell phone now. It seems like it's a candidate for hacking. You're talking about Russia and China or whatever. Seems like that may be a way that you know, you can get in and scare a lot of people. I don't know. It just seems weird.
Yeah, I don't like it either.
Yeah.
But I guess that's something that's here to stay.
I think I'd like to know for real. I mean, if it's real, but I just think it's could easily be hacked, taken over by foreign players. That's what I think. Here's the last one.
Now this is, I found this article hard to believe. That, not that I don't believe it, but to imagine that you would have a secret wedding with thousands of maskless guests.
Oh.
Yeah. I mean, but they talk about these Jewish congregations that do this and they don't wear masks and I mean, can you imagine? And finding them $15,000 is not going to do it. Those people are already exposed.
Yeah.
But in Brooklyn, they found out that these synagogues are a great place to transmit the virus because people don't pay attention to anybody else except the rabbis. But what do you think about that fine, $15,000?
I think they're gonna have trouble collecting it.
Oh, I don't think so. 15,000, that's not much money.
To them, no.
That's what I mean.
They can get that out of the one collection plate.
Yeah, I mean, it makes you wonder if they're really serious.
Mm-hmm.
Mhm.
Kind of scary. Because if a place like that can do it, other places could do it as well. And maybe are doing it as well. You know?
And other religious groups too.
Yeah, yeah. But I guess if the White House is doing it, I guess anybody else.
Why not?
Yeah, the White House is having Christmas parties.
Trump is having a Hanukkah celebration at the White House also. Did y'all
Really?
see that?
No.
No mask.
I wonder what the cleaning protocols will be after Trump leaves.
That's what I was wondering too.
You know, you got to clean that thing. It's going to be so clean, it's going to be a black house.